Now, the general class of antibiotics that can be used for fungal infections. The general class of antibiotics used for fungal infection. You need to know that what we have. The first one, the azoles. Is it clear? Among the azoles, you have ketoconazole. Ketoconazole. You have the second one. You have the fluconazole. Is it clear? We have ketoconazole, we have fluconazole, we have itraconazole. Is it clear? Itraconazoles. So those are examples of azoles that can be used. Is it clear? So they are involved there as antifungal medication. Another antifungal medication, we have the griseofulvine. Is it clear? The griseofulvine, which can be used. We have the nystatin. The nystatins which can be used. Is it clear? The griseofulvine, the nystatins which can be used. Then the fourth one, after the griseofulvine, the nystatin which can be used, we can now use the last one, which is the amphotericin B. Amphotericin B. Is it clear? So now, so these are the general antibiotics that you have to think of when you want to manage those infections of fungi. Now, after speaking about the general antibiotic, you now need to know their specificity based on the different class of the based on the different class of the fungi. Is it clear? You need to know that what in the cases of the corporea, when you have the infection of the corporea, is it clear? The best medication that is used is the case is the azoles. Is it clear? The itraconazole, the ketoconazole. So and then when you give the azoles, you give it locally and then you give it systemically. Is it clear? You use the azoles locally and systemically. Is it clear? You give the azoles locally and systemically. So that is for the corporea. Is it clear? It's mostly the azoles, like the itraconazole, the ketoconazole, the fluconazole, they can be used there. Now, when you have tinea pestis, is it clear, infections, is it clear, which is going to result to atlas foot with pruritus, it is much more, it is still local and systemic, and in this case you use the azoles. Is it clear? The ketoconazole, the use the ketoconazole, we use the fluconazole, the itraconazole. Is it clear? These are, you still use the azole for the tinea pestis. Now, when you have scalp infections like the eczema of the scalp, is it clear, which is mostly caused by Mycosporum odwini, we best give griseofulvine. Is it clear? Griseofulvine is best given in this case and still given locally to apply, and you apply also systemically the griseofulvines. Is it clear? So those are the things that you have to know. Now, the next thing after that, we now have the dermatophyton. Among the dermatophyton, we have candidiasis. So for candidiasis, you best give nystatins. Nystatins are best given for candidiasis, though you can still give those other azoles, but you give nystatins. Nystatin is given locally and systemically. Is it clear? Locally and systemically, but best at times it's given locally. Now,